You're listening to Conferences Online Allergy from Children's Mercy Hospital in Kansas City, Missouri. Today is August 15th, 2025. Our topic today is Clinical Research Design Basics, presented by Dr. Bridget Jones. She is a professor of pediatrics and is a Marion Merrill Dow Endowed Chair in Pediatric Clinical Pharmacology at University of Missouri, Kansas City and Children's Mercy Hospital in Kansas City, Missouri.
Today. So I'm going to talk about the basics of clinical research. This is really meant to be a introductory lecture for the fellows, especially those of you who are getting started on your research projects or starting to think about your research projects. So what we'll cover just some of the basic aspects of putting together a research project and a research protocol. So first, starting with thinking about how you develop your question and your hypothesis, and then the what's included in a protocol and how you might think about designing a protocol. And I have about 30 slides total, so hopefully we'll get through most of the slides, and then we can do something that's a little bit more interactive where we walk through putting together an outline of putting together a proposal. So here are the objectives today. So to understand how research questions, hypotheses, and protocols are developed, to understand how to develop a testable research question and hypothesis and a research protocol to answer that question and address your hypothesis, and then to understand how to develop a study design outline. So that's the exercise that we'll do at the end. Most of what I will present today comes from two textbooks that I would suggest you maybe consider purchasing, or I don't know if the fellowship would want to purchase these and have them available for the fellows to borrow. They're really good resources to help you and guide you and give some very practical instruction on how to first put together a research project, as well as there's another textbook that has some really good content on once you get ready to publish your results, either in an abstract form or a poster or a manuscript that kind of walks you through that process. So I highly recommend those. I do have copies of them that I'd be willing folks to borrow and make copies from, but it might be something good to just have available in our division for people to borrow. So why do we do research? I think it's important to consider why you're doing the research before you start. So I know one aspect of why you're doing it is because it's a requirement for a fellowship, but the real reason really should be to answer burning questions. So your research question should come from something that you really want to learn about or you're really interested in. And so these are things that we don't know as far as different aspects that may impact clinical medicine or aspects that impact underlying pathophysiology that we want to really know a lot more about. But in the process of answering that question, I think there's a lot of other things that come out of doing research that we may not always consider that's helpful going forward in our medical practice. So it really helps you to learn about the scientific process. So when you're reading literature in the future, you kind of understand what went into the data or the findings and the conclusions that come from that manuscript or from that publication. So understanding the scientific process of how studies are done is really helpful, and just learning how to apply different findings to clinical medicine. Helps you understand statistics. So, statistics can be kind of this black box that we go through and learn, the different statistical methods and what a p-value means. But until you really apply those yourself, it may not stick as well. And so again, when reading the literature, if you've done a t-test, or if you've done a Fisher's exact test or some other statistical test, you can better understand what that information means. Understanding study designs, how that impacts findings in studies, different biases that may be introduced in the studies helps you interpret findings and studies from the literature a bit better, as well as understanding just how to critique the literature in general. So those are some reasons why we do research. But the main reason is that we want to contribute knowledge to science and medicine that overall helps improve the lives of our patients and our community in general. And so what we learn from research and the literature that comes out of it really defines how we practice medicine in what we do. And so that's one of the main reasons. So how do you first get started? As I mentioned before, you want to think about questions that are kind of burning questions, things that you want to answer. So first, figure out, what are you actually interested in the most? Are you interested in asthma? Are you interested in food allergy? Are you interested in drug allergy? What are you really interested in? And that'll make things a lot easier if you're doing a project that you're actually interested in, rather than doing a project that just your mentor is interested in. That just makes the process a whole lot easier. And then next, you want to find some good mentors, people that are willing to share their thoughts and ideas and experiences with you, that have time and the expertise to help guide you in your research project. And I put it in plural and parentheses because you may have more than one mentor, and likely you'll have a scholarship oversight committee where you'll have to list a few people that will guide you on your research project. You might also have collaborators. So let's say you decide you want to do a project that involves genomic medicine. So you might collaborate with someone in genomics to do that project. Or if you're doing a large database survey or project, you may collaborate with someone in bioinformatics. So think about the collaborators that you might need on your project. And then I think it's especially important, when thinking about your fellowship projects, is what is feasible to do. So is it a project that you will need additional funding to do? Or are you trying to design a clinical trial that will require a lot of resources with a research coordinator, and you'll need to purchase an intervention and provide participant stipends? So is that feasible to do with the current resources that you have available and the timeline? So that leads to the next bullet. I think especially for your fellowship projects, you'll need to think about the timeline that you have, which is relatively short for doing a full research project, and what can be accomplished over that time. And then try to develop your own timeline to define your goals. So, if your goal is to have an academic product by the end of your fellowship and have your work be presented at one of our national meetings, then you'll need to follow a specific timeline for getting your study off the ground, and conducting the study procedures, analyzing your data, and writing it up to be able to meet those goals. So I think early on, kind of figuring out what your specific goal is will help you develop your timeline. Usually when I've worked with students or trainees in the past, that's one of the first things I ask them is, what is their goal for doing the research? What do they want to get out of it? As far as academic products, and then we set up a timeline to meet those goals. And so one of the first things you'll do is figure out, what is your research question? What's the question that you want to answer? So again, kind of what bugs you? What are you interested in? So in food allergy, is it something that parents ask you quite often that we don't really have the answers to, and so you would like to figure out this question to be able to add to the current medical knowledge. And so there's lots of ways where you can figure out what are the gaps that currently exist in knowledge. As I mentioned, one is patients. A lot of times patients ask us questions and, we have to tell them, well, we don't really know the answer to this. And so that might cause you to dig a little bit more into literature and to see, what type of studies have been done already to answer this question. Have there been any studies at all to answer this specific or question, or if there are there additional questions that could be asked to get at the answer for our patients. Reading the medical literature is a great way in general to develop your research question. Typically, when you read a research article, the last paragraph will talk about future directions and what else needs to be learned in a specific area and specific field. So this will give you ideas. Of course, when you attend conferences and hear other people talk about their research or talk about our current clinical knowledge in certain areas, there's always discussion of what we don't know yet and what else needs to be done. Often when you're teaching, similar to when talking to your patients, students and others will ask you questions that your answer will be that we don't know, we don't have this information. So teaching oftentimes brings up areas where there's gaps in knowledge. And then also being skeptical of the current literature. So again, when you read the literature in the discussion section, there's usually mention of any potential flaws or biases to the study design. And so sometimes, conclusions that are made might not be accepted entirely because there might have been some bias in the study or a limited sample size, or this study was conducted only in adults, and so we don't know if these same findings would be true in children. So even being skeptical or questioning is probably a better word of the current literature might help you find out additional questions that you can ask. But one of the first things I would suggest once you think that you have your question is to do an extensive literature review. So try to find out what's already been published. Make sure someone else hadn't already answered your question, and if they have, is there something that you could do a little bit differently or in a different population or something like that to add to what's already been published. And our library services is great. You can submit a request on the SCOPE website, and they will do a literature review for you if you tell them your topic. So I suggest that you utilize our library services. And so sometimes the hard part is not just finding a question, but finding one that actually can be answered in a feasible study plan. I do think it's important, again, especially for your fellow projects, to try to focus on one specific question as your primary goal, because sometimes you get really excited, and as you start to think about your questions or your question that you want to ask, the thing that bugs you, then all these other questions come into play as well. But really try to focus on one specific question that you will then use that question to design your study around. And then you might have other secondary questions that would be kind of ancillary analyses, but try not to let that muddy how you would design your study. So once you come up with what you think is a really good feasible question, again, bring that back to your mentors, to your collaborators, to your research team, and have them kind of walk through and talk it through with you about your research question, and that'll help further refine it. And so your research question really sets up what the objective of your study is. The question really seeks to answer an uncertainty that you want to resolve. And so an example of how you might start a research question, it could really just be first a general observation or general thought. So something like, should children receive more vitamin D in their diet? So that's a very broad statement. So how could you further refine that? So next, you might want to think about, well, if you're saying that children should receive more vitamin D in their diet, are they vitamin D deficient? So are there studies out there that show that many children are vitamin D deficient? Have those studies already been done? So you might find studies that show that, many children are considered vitamin D deficient by whatever cutoff that's been used. So if they are vitamin D deficient, does it even matter? Are vitamin D levels associated with some condition or some outcome? So are vitamin D levels associated with asthma? Are there studies out there that show that? So you might find that there are studies that show that vitamin D levels are associated with asthma. So what else could we ask about vitamin D? So does vitamin D supplementation decrease asthma risk? So that might be the next step that you think about. And again, go to the literature, see if there's been studies done already out there looking at that. And so that's just kind of how you might work through, kind of this initial observation, very, very broad, and then kind of drill down to a more refined and feasible question to answer. So that gets at this mnemonic that is used to describe what type of research question you want to develop. You want it to be feasible, so something that you can actually answer. It should be interesting. So again, interesting to you and likely interesting to others. So when you're talking to others about your research question, it'd be something that people say, oh yeah, I think that's worth answering. Novel, so it should be a relatively new idea. Ethical, of course, we have to abide by ethical guidelines, so you want it to be something safe and ethical, and then it's relevant to either the medical practice or the science in that area. And so this is a quote that someone used in a study review meeting I was in a few months ago, and I think it's a good succinct way to kind of think about research projects. So one is, can it be done? So is it something, can you actually do this study or answer this research question? And should it be done? So if you're thinking about there's a finite amount of resources that can go towards research and science, should it be done? But also ethically, should this be something that's done? So that's another way to think about it. So kind of breaking the feasible mnemonic down a little bit more, the finer mnemonic a little bit more. So going back to feasible. So some of the things you think about for feasibility is, do you have the adequate number of participants available to do the research study? So let's say you want to do a study where you're recruiting participants that come into our clinic. If it's a study that's looking at patients with SCID, we likely don't have enough participants just in our clinics to do a study like that. So do you have access to the adequate number of participants? If you don't know, you might start by doing a chart review or pulling ICD-10 codes from the medical records to see how many participants or how many patients we had come through our clinics over the past year that had this diagnosis. Sometimes it might even start with a pilot study to determine feasibility of being able to recruit a certain participant population into a study. That's probably not something that you have time to do during your fellowship, but for other types of studies, it might start with a pilot. Do you have the adequate technical expertise to conduct the study? So are you doing studies that will need other experts, like I mentioned, someone in genomics or someone in bioinformatics? Do you have access to that at your institution? Could you identify collaborators at other places to help you with your research project? Talking to a statistician early on is always really helpful. They can help with asking you some really great questions about the feasibility of your study to help you work through that. Is it something that's feasible and allowable, particularly in children? If you're thinking about a pediatric study or some other type of vulnerable population, so is it a study where you're needing the child to do something? Let's say you're needing the child to do spirometry measurements, so that will limit the age likely of the children who are able to be in your study. So are the activities that are planned, is it actually feasible to do? Do you have adequate technology support, study population? Do you have adequate time and funds, which we already mentioned? And then just making sure that you have a manageable scope, that it's a project that's manageable for you to handle over the time period that you have. And again, I think, I can't stress this enough in just focusing on that one primary goal and not thinking about answering a whole bunch of questions at one time. Is it interesting? Like I already mentioned, of course, what are you interested in? What are the others think? So discussing with mentors and peers. You might also think about patient and community advisory boards. So this is becoming much more of a standard practice, is that, researchers, a lot of times we'll think about our research projects and our research questions kind of in a vacuum by ourselves or with our research teams, and not really talk to the patients and the community and ask, is this something that's of value to you, or does this study sound like something that you would consider participating in? Or what would a study look like? What would you like to see? What type of study would you like to participate in? So Children's Mercy has research advisory boards. They actually have both just a regular research advisory board that's made up of patients and community members, and they also have specifically a teen advisory board, so you could even get feedback from adolescents and teenagers about your research to see if it's something that they would think is important. Is it novel? Does it contribute something new to our current medical knowledge? So again, review the literature, do a really good literature search, discuss with experts. Replicating previous studies can also still be novel. So again, you might think about past studies that have been done in different populations. So if a study's been done in adults and for whatever reason has not been done in children, it will be helpful to have this same information in children, or know if this same phenomenon occurs in kids. Then you could think about doing studies in children. Also think about the representation in studies in general. From a racial and ethnic perspective. So are there studies that would be useful in other populations? Could you replicate studies with improved techniques? So replicating previous studies could also be novel. Ethical. So of course, you don't want to do anything that's going to put patients at significant increased risk of physical, mental, or privacy risk. And of course, there's regulations that we have to follow around that. I would suggest, again, like meeting with a statistician, you consider discussing with an IRB staff person early on when you're designing your study, especially if you're have any concerns about any ethical considerations. And then for for children especially, there's special considerations for children. If you're doing genetic studies, there's special considerations for genetic studies and also for other vulnerable populations. And then again, going back to your community and patient advisory boards, are there ethical things that you might want to work out with the community or patient advisory board? The question, again, should pass the so what test. So you want it to be relevant. So something that's important, it adds to our current knowledge, could potentially influence practice guidelines, influence policy, or guide further research. It could be kind of a step to the next research question that might be a larger question, or some might consider a more impactful question, but it's an important first step. So again, you might go back to that question of can it be done and should it be done. So next, when you have your research question, you might want to start thinking about writing your research protocol. So a protocol is kind of instruction of kind of an overview of what a study is, kind of what your question is, what your hypothesis is, and we'll walk through that a little bit more, but how you're going to actually do your study, how you're going to analyze your data. So if you're submitting an IRB protocol, they can be anywhere from 5 to 12 pages. Often you will write a research protocol if you're applying for a grant. So you have a protocol type design within your proposal, but it really just helps you organize your research logically, efficiently, be able to communicate that to others. So the protocol really addresses the why you're doing the research and the how you're doing the research. And so first you'll have your research question, what some will call your significance or innovation, or your discussion section of why you're doing the research, your design, your subjects, or better terminology is participants that are included in your research, the variables. So these are the measurements that you will collect to analyze to address your hypotheses, and then how will you do your statistical analysis. So for your research question, like I mentioned before, again, focusing on one question and kind of giving examples here. But so the pros of having more than one research question, you could maybe have more than one question that can answer two things at one time. It might be a little bit more efficient with one study. So an example here is the effect of a blood pressure medicine. So where you're looking at both the risk of heart disease and stroke. But the cons of trying to answer more than one question is the complexity of the design. So you'll have to design a study where you have variables that you can measure both of these, heart disease and stroke. And so that adds a whole nother level of complexity to your study. And then it can also be a little bit more complicated in determining your sample size that's needed, depending on the incidence of heart disease and stroke in a given population, and how you set up your statistical analysis designed for multiple hypotheses. So again, establish a single primary question to focus your study on and your sample size on. And then you can add secondary questions that won't be powered to necessarily answer that question, but you can add some secondary research questions that are considered more exploratory, that maybe will help inform a future study around that question. And so next, the background section describes kind of the how or why you're doing the study. So it establishes the rationale for your study. So again, you've already done your literature review, so you know what's already known in this subject and not known. So what is the gap that you're trying to fill? Why is the research question important? So what could this mean to clinical medicine, or what could this mean as far as understanding underlying pathophysiology of a certain disease? If you are able to address your hypothesis, what answers will this study provide? What will the study conclusion add to the current body of your literature? So in grant applications, this is often broken down into the significance and innovation section. If you're writing a IRB protocol, it'll be just a general discussion section, usually. But in grant applications for significance and innovation, the significance is considered the positive effect that successful completion of your research project is likely to have as the result of solving an important and relevant problem. And then innovation is about what are you doing that is new or novel. So a new and substantially different way of considering or addressing an important public health relevant problem that results in substantive departure from the status quo, thereby enabling new horizons. So these are two areas that you might consider addressing in your discussion. And we've kind of already gone over that. So I'm not going to go into this a little anymore, so we can hopefully get to our exercise in time. So for your design, so the design is how the study is being conducted. So you have your research question. So how are you going to set up your study to answer that question? So there's two major study designs. So one is an observational study, the other is an experimental study. So an observational study is, you think about as a passive study. So you're not doing anything to a research participant. You're just going to observe in some way what happens. So an observational study might be just examining the incidence of asthma in children with low vitamin D levels. So you might design a study where you obtain vitamin D levels, or you collect data from the medical record of vitamin D levels that are done in children and look at how many have a diagnosis of asthma. So you're not applying an intervention, where in experimental studies you're applying an intervention. So there's an activity that's going on, and you're looking at the effects of that intervention. So an example would be an intervention of vitamin D supplementation, and looking at whether or not vitamin D decreases asthma incidence in children. The gold standard is a randomized blinded trial for interventional studies. So you randomize participants to either placebo or the active agent or the active drug. It's double blinded, where both the primary investigator and the participants are unaware of whether they're on the placebo or the intervention. That's kind of the gold standard for experimental studies. So this is just kind of walking you through the different study designs a bit more. So kind of starting first at a descriptive study, more observational. So what is the average vitamin D intake in children? So again, if you don't know that, and your question is about should kids get more vitamin D, you might just say, okay, how much vitamin D do children get on an average day? And so that would be a observational, descriptive type of study. And then you could move into more of an analytical study. So what does it mean to, these levels? How could it be important? So is there actually an association between vitamin D levels and asthma? And then if your findings show, or the literature search shows that there may be an association there, then you could design an experimental study where you're looking at this intervention of vitamin D supplementation and asthma risk. And then, so next we'll talk about the participants in your study. So that's who you're going to include in your study, your target population. of what you want to look at. So again, if you want to look at, children with asthma or children, in vitamin D supplementation, who would you want to include? Which age groups would you want to include? Would you want to exclude kids with certain other diagnoses if you're wanting to look at asthma as a outcome? And so you'll need to specify what are your inclusion, who can be in your study, or who do you want in your population, and who should be excluded because they might introduce some bias or confounders into your study. So there's always trade-offs, especially if you're recruiting for a prospective study. So you're trying to enroll participants into your study prospectively. There's trade-offs of having the perfect desired study population and the ability to actually recruit participants into your study. So sometimes initially we'll design studies that the recruitment is just a little bit too strict, and you realize that this study won't be feasible with such strict recruitment requirements. But you can consider, let's say you're doing a study in adults and you want to, study patients with asthma, but you want to exclude those that smoked within the past 20 years. So you might find that that's too strict of a exclusion criteria, and you're not going to be able to recruit enough participants in your study. So you might open that recruitment up and say, okay, haven't smoked in the last 5 years or something like that. And then you'd consider the potential bias or confounding that was introduced by allowing those people into your study, and disclose that and discuss that when you describe your findings in the literature. So for recruitment, if you're doing active recruitment, or if you're doing recruitment, there's a couple ways to do recruitment if you're recruiting new participants into your study. There's passive recruitment versus active recruitment. So passive recruitment is really letting the participants come to you. So these might be things like hanging up flyers or putting out social media posts where the public or the patient will see this flyer and say, oh, hey, yeah, I have this condition, and they call you or send you an email and say that they want to be in your study. Where active recruitment, you're going out and actively seeking participants that meet your criteria. So you might use things like diagnoses codes and pull a list of all the participants that come into our hospital or come into our clinic with the participant code, and try to reach out to those potential participants. The way that I do a lot of my research studies is that we're actively reviewing daily patient schedules to see who's coming in and who may meet our criteria, and then we actually approach them in clinic. So there's lots of different ways to do that. Again, kind of thinking about what your target participant population is, and again, kind of what's feasible to do with the resources that you have available. The recruitment piece is also another piece. We're getting input from community advisory boards, and research advisory boards may also be helpful, because they can really give you some things that maybe you wouldn't think about of ways to recruit for a study. And then your variables are what you're going to measure to be able to test your hypotheses. So it's the entity that can take on any entity that can take on different values. So the things that you're going to measure that could take on different values across your study participants. So, for our vitamin D example, vitamin D intake, or how much vitamin D a patient is getting in their diet each day, might be one variable. Age, race, gender, those are all variables that can take on different values across your study population. So the major types of variables are your predictor variables and your outcome variables, and then you have confounding variables, which I touched on a little bit. So your predictor variable are the things that occur first based on biological grounds. So those are things like age, gender, your vitamin D intake, and then your outcome variable are the things that your predictor variable might influence, or you're looking to see is it associated with or influencing in some way. So your outcome variables would be the thing that you measure, like asthma diagnosis. Do they have an ICD-10 code of an asthma diagnosis, or do they have a physician diagnosis of an asthma diagnosis? Asthma exacerbations, how many have they had steroid bursts over the past year? How many steroid bursts and hospitalizations have they had to meet the criteria of an asthma exacerbation? FEV1, quality of life. So these are the things that you will measure to relate to your predictor variable. And then again, you want to think about confounders that could impact your results. So could there be geographic differences or cultural differences in things like vitamin D intake based on diet or other differences? Are there differences between urban and rural areas? Things like smoke exposure. So consider those things that could confound your findings, and it's okay to have those. You'll always have confounders, but just making sure that you're aware of those when you analyze your data, and of course when you discuss your findings is important. And then finally, you'll have your statistical analysis plan. So once you develop your study question, you'll also want to develop your study hypothesis. And so your hypothesis is what you'll use to design your statistical analysis around. So if your question is about vitamin D intake, your hypothesis is what you want to test to see whether it's true or false, what you want to prove. So your hypothesis might be that children who take vitamin D supplementation will have lower risk of asthma than those who do not. So again, it provides the basis of how you'll set up your statistical tests, what types of tests that you'll choose, and also will set up how you calculate your sample size, which is the number of participants that are needed to observe the expected difference in the outcome between groups that you're comparing with a reasonable probability. So for your statistical analysis, you'll develop your plan for your sample size, working with your statistician, a plan for how you're going to collect, manage, organize, and analyze your data. So again, meet with your statistician very early on. Again, I would say when you're first developing your research question, because then they can help you develop your hypothesis and further help you set up your design from there. So that gets us next to this one-page outline that I think is could be really helpful when you're first starting your research project. Just a way to organize your thoughts and kind of checklist through all of those different components that I just mentioned here. Helps you kind of clarify things as you work through it, of things that maybe you haven't thought about, or how you'll actually measure things, or whether or not you can measure them or not. It's just useful, kind of to have this brief outline when you're discussing your project with others and getting feedback, and just provides a framework that can be further developed out into a full protocol. So this is the one-page summary that you might consider using when thinking about your project. So first, you'll probably start first with the research question before you have your title, but the title is listed here first. But the first thing you want to do is think about what your research question is. Start thinking about what the significance, innovation. Why is the question important? What are the gaps that you're feeling? How will you improve knowledge and impact medicine and science? So start to think about some of those things. What type of study would you think about? An observational study, experimental approach? What would be your participants that are included? Are you considering including children, adults, both? What age group? What specific diagnoses for entry? Who might you want to exclude from the study? How will you gather your data? Is it going to be gathering your data directly from participants, or are you doing a chart review where you're pulling data from the medical record? What are your variables that you're going to look at? Is it vitamin D or age or some other variable? And what is your outcome variable that you wanting to measure? So is it asthma diagnosis? So how will you define that? Will it be, asthma diagnosis based on the physician note saying that they have an asthma diagnosis? Is an asthma diagnosis based on the parent or the patient report that the child has a asthma diagnosis? And then further thinking about your hypothesis that you're wanting to test, and then build out from there of kind of what the sample size that you'll need and the actual statistical analysis that will be done. So this is the example here, again, using vitamin D. So let's say you wanted to do a study that answers the research question of, does vitamin D supplementation decrease the risk of asthma in children? And first, your significance, you might have, done your literature search, and you see that children have been found to have low vitamin D levels. There are studies that show that low vitamin D levels are associated with asthma risk in children, but there's no studies evaluating the impact of vitamin D supplementation in children on asthma risk. So that's the study that you're saying that you're going to conduct this study to fill this gap. So your study design might be a prospective randomized clinical trial where you're going to actually give participants, randomize them, give them vitamin D versus placebo, and look at the outcome of asthma risk. So you want to include children. Let's say you want to go down to 2 years of age and up. And recruit them at, I don't remember what I put here, child checkup. I don't know what that means, but 2 years and up might be your entry criteria. And for your sampling design, you will have just consecutive sampling of consenting patients. So you're just going to enroll kids as they come into the clinic with kind of a convenient sampling method. And then your variables, your predictor variable would be vitamin D supplementation, so what they're receiving as the intervention, and then your outcome would be diagnosis of asthma at 6 years old. So you're going to enroll them at 2 and then follow them for the next 4 years, which would be a very long study. But your hypothesis that children receiving vitamin D supplementation will have lower risk of asthma than children not receiving vitamin D supplementation. So you've worked with your statistician and determined that you will need a sample size of about 120 participants. Would be required to determine a 20% difference in incidence of asthma. So you need to figure out, okay, what's a clinically important difference? So a 20% difference in asthma incidence would be a pretty big deal. So that's kind of how you set up your analysis. So you want to see a 20% difference in incidence between the two groups of vitamin supplementation and no vitamin D supplementation. You'll use a chi-square test to compare frequencies of the incidence across the groups with a p-value of less than 0.05, which is kind of often a standard p-value that's used. So that's how you might set up just this kind of one-page summary that then you can take and show to other people and get feedback and further refine your study design. So before we move into the exercise, I also wanted to actually, let me go back. So let's actually go to the exercise, and then I'm gonna, let's see, stop sharing here, and well, I do want to still share the outline because I want us to kind of take just a few minutes and walk through this briefly. Let's see, let me try. Okay, can you see now the one-page summary in the non-presenter mode?
Yes, we can.
Okay, all right. So let's walk through this. Let's see, can I still type here? Yeah, so let's walk through this. So does anyone have a research question that they have thought about? And it doesn't have to be something that's, completely thought out. We're just kind of walk through the exercise of what you might do. It looks like the chat isn't available. So I don't know if is the chat enabled. If you're not able to unmute.
Yeah, with some changes in Teams, we're not able to get the chat to work on this format. So.
Okay. Yeah. All right. Research. Does anybody have a research question or just a general idea? I know some of you have to have something that you've thought about. I can call on people, but I'd rather not. Okay, Matthew, do you have a general idea or question?
I really don't. I was just talking to Dr. Miller about this last week, but I'm still kind of thinking it all through and don't have a great one yet.
Okay, do you have one that's not a great one?
I'm sorry, I can't think of one right now.
Okay, Melissa, do you have one?
I don't have one off the top of my head. No, sorry.
Okay, so what we talked about before was vitamin D supplementation. So what about, are there other vitamins that you might think about that could have an impact on asthma? Okay, so I know one. So I'll give you guys a research question. So one is, I know there's some early work looking at vitamin C. I can type. In prevention of asthma in infants. So providing vitamin C supplementation during infancy, could this prevent asthma? So what are some areas of significance that why could this be significant? If we show that vitamin C supplementation could prevent asthma, why would this be important?
It would be a cheaper intervention that could save healthcare dollars down the road and certainly, improve, potentially improve mortality.
Improve quality and yeah. Okay. So is asthma a really big healthcare issue?
Absolutely.
Yeah.
Big cause of ER visits, especially in the winter time.
Yeah. So there's some studies that show that asthma, 8 to 10% of the population has asthma. So if we could find something to prevent a chronic condition in 8 to 10% of the population, that might be a big deal. And it sounds like there's a gap there. So we maybe don't know if vitamin D improves asthma. So that's something that, or vitamin C decreases asthma incidence. So that's something that we could answer So those are some of the things you think about for the significance. So how would you design a study looking at vitamin C supplementation in preventing asthma? So would you do an observational study or experimental study?
Probably experimental.
Okay, you could do experimental design. What would you do in experimental study?
I was thinking I guess you could do a prospective cohort with one cohort receiving vitamin C supplementation and and the other just not, and then and then kind of look longitudinally at who develops asthma, who does not, and you could also kind of look at the severity of the asthma that they develop.
Okay. So would you do like a placebo, like a randomized trial, or you just follow kids and look at who's already taking it?
Well, yeah, that's a good question. I guess in my head, I wasn't necessarily thinking of a placebo, just one group taking vitamin C and one group who's really not getting any intervention, just sort of a control group. But
yeah, so those are two different ways that you could think about designing your study. And there could be pluses or minuses to both of those. So that's really good to think about, multiple ways to do the study. Again, depending on where you are in your study question, what preliminary data do you already have, and then what's feasible. Okay, so who would you include in your study? Anyone else? Go ahead.
Sorry. Yeah, I'll let other people.
I was going to give, but go ahead, Matthew, if you want to. But if someone else wants to chime in.
Yeah, you could do like patients with, depending on, I guess, the severity of asthma you wanted to look at. You could do like patients ages 0 to 65 who have been diagnosed with like mild persistent asthma, maybe.
Okay. So patients 0 to 65 with mild persistent asthma. So let's go back to your research question. So your research question is whether vitamin C supplementation will prevent asthma. So you might want to think about including people that don't have a diagnosis yet, right? If that's your outcome that you're wanting to see, does it prevent asthma?
Right. So maybe people who don't have a diagnosis of asthma, and then
okay. So just people in general, or you might want to think about, most patients are get an asthma diagnosis usually in childhood, right? So you might want to think about even before they have a diagnosis. When's the likely time where we would catch them to where we could give them something that could actually be preventive? So you might think of a younger age group then, maybe, right?
Right.
So I don't know, 0 to 5 or 0 to 2, or if you're wanting to really have a more strict criteria. But again, that's going to impact who you can recruit and how you can recruit from your study. So let's say 0 to 5 years who don't have a diagnosis yet. You might consider, if you really want to kind of think about who could be most impacted by this intervention. So it might not be that all kids need vitamin D supplementation. It might be kids that are most at risk for developing asthma. So it could be kids 0 to 5 that are already atopic, but they don't have asthma yet. And then you can think about how you're going to recruit the participants. I know we're running out of time. Your predictor variables. So your predictor variable is what is it that you're going to measure? So it's vitamin C, right? Maybe vitamin C levels, and then the outcome that you're wanting to look at is is what?
Just whether or not they end up with a diagnosis of asthma on their chart, at the end of the study period.
Yep. So asthma diagnosis, and that could be measured in lots of different ways. And then you kind of think about your hypotheses. It sounds like your hypothesis is that vitamin C supplementation will prevent asthma. And then kind of use that to decide, okay, how many participants do you need to enroll in this study, and what type of design, if you're looking at incidence rates or frequency or what you're measuring will kind of determine what type of statistical design you have. So yeah, so that's kind of how you would put together a one-page summary. We did that relatively quick. I think this is kind of a easy place to start from. Again, you'll probably work through this multiple times until you get your study question, your hypotheses, and your design all finalized. But this is a good place just to start. So with that, I just wanted to share here some resources at Children's Mercy. I mentioned before about meeting with biostatisticians. So the CMRI has a biostatistical core, and they actually have funding where they can help work on trainee projects. And so I would suggest, working with them or reaching out to them if you have those types of needs. We also have a bioinformatics core that can help you if you're wanting to do like big chart reviews or big database analyses as well. We also have a medical writing center that can be helpful once you get to wanting to write up your manuscript. It can help in reviewing and editing your manuscripts. Library services is great. They can pull articles for you if there's articles that you need, or like I mentioned before, even do literature reviews. For those of you who may be interested in writing a grant, Children's Mercy also has grant writing workshops that you can participate in if that's of interest to you. The IRB is a great resource. Again, when you're first starting your study, if there's some regulatory or ethical things that you want to think about, just contacting the IRB staff person and asking to have a call and talk about your project. They're always willing to do that. And then I'll skip down here before I talk about AIR, but Frontiers, CTSI. So if you Google Frontiers, CTSI is the Clinical Translational Science Institute that Children's Mercy is a part of. It provides infrastructure to support clinical and translational research. So there's resources there like manuscript writing support and other services, biostatistical support through them that we can also utilize. So you might go to their website and see what types of resources they have as well. And then I was going to put a plug in. We have a, let's see if I can get the link to work real quick here. We have a, you probably can't see.